And finally, Ogara Collin from Makerere University, Uganda. Acceptability of a new 4-in-1 Abacavir, Lamivudine, Lopinavir, Ritonavir Pediatric fixed-dose combination, the Caregiver-Child Dyads perspective.
I would like to thank the organizers for the opportunity to present the qualitative results of the Lollipop Acceptability Study. I am Ogara Collin, a qualitative researcher on this study. So, we set out to investigate a new 4-in-1 pediatric fixed-dose combination of Abacavir, Lamivudine, Lopinavir, and Ritonavir, which was developed by CIPLA in partnership with DNDi for use in low-resource settings where infants and children have challenges swallowing tablets. Overall, this study is also presented at this workshop. So what was the objective? The objective was to assess caregivers' perceived acceptability and related factors of the 4-in-1 formula compared to pellets and tablets. Under the methods, we are saying that it was an open-ended randomized crossover pharmacokinetic safety and acceptability study. And we purposively sampled and administered 18 semi-structured interviews to caregiver Dyads between 3 to 19.9 kilograms. Interviews were conducted after the 21st day of the 4-in-1 as shown in the figure in this slide. We use an inductive thematic analysis with support of a computer software called NVivo version 12. So now I move to the results. And I first want to talk about caregivers' perception regarding caregivers' acceptance of the 4-in-1, and later on, I will talk about the factors related to their acceptability. In overall, the caregivers had a better experience of the 4-in-1 than any other formula. For example, the syrups and pellets that they previously used. Hence, the 4-in-1 was highly acceptable. On matters of children's acceptance, I want to say that most children enjoyed it because it was sweet. As one of the caregivers noted, she likes and enjoys it because she responds very well. She does not become nervous when she is taking the formula. Now I want to move to acceptability factors relating to the formulation and storage. Many felt that the 4-in-1 was easier to store. This was because it is kept at room temperature, unlike previous formulas. In addition, the formula 4-in-1 had an average 5 minutes time taken for administration compared to others, and this gave caregivers a better perception about it. As one of the caregivers noted, another good thing is that it is stored at room temperature than the first ARV syrups, which required someone to find a fridge to keep them safe. Now I want to talk about acceptability factors relating to the packaging and testing. So generally, the packaging was received well by most of the caregivers. However, for a few who said the bottle was too big. And then for the children, the taste was nice for the 4-in-1, as I said earlier on, so it was sweetish. And this is backed up by experiences where one of the caregivers noted that their experience has been good and easy. Oh, this formula is an easy form because you just open the capsule and pour it in honey, porridge, or milk and give it to the child. Now I want to move to aspects around factors related to caregivers' acceptability. And here we are saying information and adherence. And under information and adherence, caregivers learned easily how to correctly administer the 4-in-1 because they knew the effects of a missed dose. As one of them noted, not adhering to the drug, the child's soldiers reduced, meaning a high viral load. Under motivation, the caregivers had witnessed positive results of the 4-in-1 in the short run or in the short term in terms of weight and growth of their children. And this gave them a ray of hope that their children's future was bright. For example, one of them said, when my child grows up, I would like him to become a doctor so that he can also treat others. Now I want to move to issues around caregiver skills and innovation. And I want to say many of the caregivers adopted innovative approaches to remind them and keep time. For example, alarms on their phones and others. As one noted, I set my alarm at 8 a.m. and 8 p.m. and that is the time I give my child medicine. Finally, I want to move to the aspects of support needs. And we are saying caregivers, through counseling and tips to administer the 4-in-1 by the health workers, were very influential in acceptability, yet this study was short, so in the short run adherence. As one of them noted, the first day I started using the 4-in-1 formula, I poured the powder, that is like millet, on a spoon and put it in the mouth of the child, but it made him tend to vomit. So I asked the doctor, who advised me to mix the medicine in 2 little porridge and then give the child. This method worked very well for me. In conclusion, I want to say that the 4-in-1 is a better accepted pediatric formula than other formulas previously used. I also want to say that acceptability was greatly influenced by the formula itself in terms of test, ease to administer, and storage. And finally, I want to say individual motivation and tailored specific support to caregivers influenced acceptability. Thank you very much for listening to me, and I want to acknowledge all those who supported this study to take place. Thanks a lot.